Many families have to choose between food and drugs, and that's really it's a difficult place to be.
Tonight, we begin a three-part 11 News investigation that we hope will educate, inform, and quite honestly, save you a few dollars.
We're talking about a national epidemic, the significant costs of prescription drugs.
And in the first part, THV11's Mary Mose explains how we reached this point and why some of these drug prices are so inflated.
Craig and Denise, routine medicines used to treat diabetes, deadly allergic reactions, cancers, or seizures. They're all necessary, so manufacturers can rely on our purchase. But our diseases become incurable when we can't afford the cure. You've heard of them, or you're using them, like the injectable Humira for Crohn's disease.
Since 2011, it's had a price increase of 68%.
Or maybe the allergen injection, EpiPen.
We've experienced a 139% increase.
Or how about Xyrem for narcolepsy? It spiked 116% in 5 years. All of these adding up quickly and often.
We see some manufacturers raising their prices 2 times a year, 3 times a year.
These price spikes consistent nationwide. And behind it all, the drug companies.
Internally, we tend to chalk that up to greed.
For example, the Novolog FlexPen by the drug company Novo Nordisk increased 73% over the last 5 years. In 2011, it sold for $222. Today, it sells for $500. And with only 5 pens in a pack, it lasts a patient only a month or less.
Simply because they can.
Yeah, prescription drug price inflation is that simple, says Scott Pace, the CEO of Arkansas Pharmacists Board.
Not because there's an increase in demand, not because there's a raw material shortage, but simply because Valiant could get away with charging more for their product.
Dr. Dwight Davis of UAMS researches the price trends. He's seen the highest growth over the last 10 years.
Most of the increase was driven by average claim cost. And so that tells us that we've seen significant increase in the drug cost itself.
Whoa, wait, what's average claim cost? I get it, it's confusing. Let's break down how average claim costs makes your medicine so expensive. When you go to the pharmacy to pick up your prescription, the pharmacist writes a claim to your insurance. That claim determines how much the insurance company is going to pay and how much you pay. Let's say I have a high deductible. I'm going to feel the effects immediately right here at the pharmacy counter, paying entirely out of pocket. But if I pay copays, I keep paying the same flat rate every time while my insurance company picks up the higher cost. Sounds nice, right? But I'll start getting hit once my insurance company decides to raise my copay to help with the total cost. Either way, we pay because it's legal.
There are no regulations that we're aware of that govern how often price increases can be taken.
And the FDA does not have control over them either.
We have a Food and Drug Administration that regulates the safety and efficacy of products, but not any agency that governs the pricing of those products.
Health insurance companies now stuck, unable to make their patients' health a top priority.
Many families have to choose between food and drugs, and that's really it's a difficult place to be as a healthcare provider because you want to help them every way you can, and it's not always possible.
Leaving families to fight their illness all on their own.
We would have sold the house, all the furnishings in it, all my wife's jewelry, and we couldn't have afforded the medicine.
That's Doyle Burkfelt of Batesville. He could not afford the drug Harvoni, the only cure for his wife's illness. In the second part of a 3-part investigation tomorrow night, Winnie Wright will introduce us to this family and their struggle to afford a life-saving drug.
All right, thank you, Marielle. And this was the first in our series of stories on the pharmaceutical fight. And since we first mentioned that we were going to do this, we've heard from thousands of Arkansans who have faced desperation and anxiety in trying to pay for the drugs family members need. Since this is home, we want to assure you that we are committed to bringing you those stories that will help improve your life. The rising costs of prescription drugs, as Marielle mentioned, is something that touches or will touch each and every one of us. We'll continue to follow this issue and work to get answers and viable solutions for Arkansas families. Last night, we introduced you to the growing problem of rising pharmaceutical drug costs.
It's a national epidemic affecting many people who take routine medicines.
And tonight, in part 2 of our 11 News Investigate series, in some cases, the high cost of certain drugs making many families make some really hard decisions.
Winnie Wright brings us the story of one husband fighting for his wife to the very end.
His name is Doyle Burkfelt. The medication his wife needed is called Harvoni. And as I quickly saw, Doyle would have done anything to help his wife.
We had a lot of fun.
Doyle Burkfelt, a retired minister, and his wife Darlene, a pediatric nurse, lived a happy life in sleepy Batesville, Arkansas.
Whatever we did together.
It's a bond that lasted for decades. Doyle and his wife Darlene, the best of friends through some of the worst of times. In January of 2015, Darlene died at the age of 70 after a short but exhausting fight with hepatitis C.
She had had this bleeding ulcer many years earlier before they even knew there was a hep C. So she had a blood transfusion at that time, and they didn't test for HC because they didn't have it. So they don't know if she got it that way.
When Darlene was first diagnosed with hep C in the spring of 2014, Doyle says doctors didn't offer the drug Harvoni as a possible cure for his wife's condition. Harvoni had just come out. It was the successor to a drug called Sovaldi. Both are made by Gilead, a U.S.-based drug manufacturer.
Said there's no cure for hep C, you just live with it.
Doyle, unwilling to part with his beloved wife, began to do research, and that's when he found Harvoni online.
It would have been over $100,000 for a 90-day supply.
The Burkfelts could not afford the drug.
We would have sold the house, all the furnishings in it, all my wife's jewelry, and we couldn't have afforded the medicine.
Doyle says his insurance company told him they didn't cover Harvoni, so he called pharmacies directly. He says they told him it would be $1,100 per pill on a 1 pill per day for 90 days treatment plan.
If the pill had been half that, I'd have found the money one way or the other.
When you've got a disease that affects 4 to 5 million people in the United States, people who would qualify for treatment, there's no reason to charge $1,000 a pill. You're going to make your money back charging half of that.
Dr. Angelo Coppola is a gastroenterologist here at Little Rock Diagnostic. He says the FDA has approved alternatives to Harvoni like Vicurapac and Sovaldi, but they aren't any cheaper than Harvoni.
All the medications have about the same efficacy within a few percent. Most are between 92 on up to some recent studies have shown 100% efficacy in curing patients with hepatitis C. The cost of the medications are all within 1 to 2% of each. They're all running around $1,000 a day for the medication alone.
Dr. Coppola did not treat Darlene Burkfelt. We reached out to him after his name was listed on the Harvoni website as a provider.
I've had patients who have offered to sell their house, sell their car to get the payment, and I've told them not to, that we can find a way to get it covered.
Dr. Coppola says patients further along in the disease typically get help from the insurance companies first. But he says it is always a struggle for him to get help for his patients.
For most of my patients, I will let them know that they're going to get refused first time we submit for treatment. Insurance company is going to deny them treatment. We'll then turn around and we'll submit again, sometimes up to 5 times, before we are able to get approval. Most of the time we can get approval, but it does take an enormous amount of time on both our side as well as the patient's side.
Even still, he doesn't blame the insurance companies for the high cost of prescription drugs.
That is driven 100% by CMS, Centers for Medical Services, governmental insurance. They come in and say, this is what we're going to pay for these treatments. This is what you're allowed to charge. Insurance companies then come in and follow them. So whatever Medicare does, we can expect insurance companies are going to do in a few years.
In the end, Doyle blames the drug companies for the high cost. He will never know if Harvoni could have saved his wife, but he would have liked to have given it a try. He was willing to do anything to save Darlene.
I've never been back to the grave. My wife is not there. So there's no reason for me to go.
We reached out to Gilead Sciences Incorporated for an interview. They offered this response in part. Unlike treatment for chronic diseases, Sovaldi and Harvoni offer a cure at prices that significantly reduce hepatitis C treatment costs and deliver savings to the healthcare system over the long term. The one-time cost of Harvoni or Sovaldi pales in comparison to the lifetime costs associated with treating HCV. To date, more than 1 million individuals around the world have been treated with these products. And we do feel it's worth mentioning that shortly after we interviewed Doyle Berkfeldt, he passed away at the age of 73.
Rising prescription drug costs putting a strain on families.
It's a struggle we've been telling you about all week. Tuesday night, Marielle Mose explained how we got here.
And last night, Winnie Wright shared the heartbreaking story of a couple affected by the issue. Tonight, we're looking past this problem as THV11's Dawn Scott looks to the future for a solution.
Finding a pharmaceutical fix is difficult at best, but there are loopholes, and help for lowering your costs is available.
Hey, Miss Dina.
Hey, Dr. Shaw.
How are you today?
I'm fine.
It's good seeing you.
At St. Vincent Infirmary, inside Dr. Bushra Shah's exam room 9, the heart of American medicine.
I was just wondering, have you been taking your medication?
Dr. Shah's patient, 61-year-old Dina Fowler, suffers multiple illnesses, migraine headaches, high blood pressure, diabetes, and then 2 weeks ago, a devastating diagnosis of breast cancer.
We've always struggled.
Fowler's husband, Johnny, is epileptic. Both of them require multiple medications.
Insurance does not want to pay for his. We've really struggled with that fight. So my medicine will get secondary to making sure that he's got his first. And sometimes I don't get mine because I've got to get his first.
It is a dire struggle. Dr. Shah says that in some cases means the difference between life and death.
It is a limiting factor for physicians to effectively treat their patients if you can't treat them or give them the essential treatment, which is their medications.
Because they kind of have you over the barrel. You know, they know you have to have it.
So doctors work with hospital social worker Carla LeMay.
It's just so many little loopholes that you can kind of, jump through.
Day in and day out, LeMay hears patients' heartbreaking stories.
They'll come back into the hospital and they will not have gotten their prescription filled. So they've bounced back into the hospital with their pneumonia worse or, the infection in their leg worse or whatever, and they'll say, well, I couldn't afford it. Why didn't you call or why didn't you tell us beforehand? Why didn't you tell us? Why didn't you ask?
Because asking, LeMay says, is the #1 way patients can start to save money.
Is there any other medicine that can do the same thing that's cheaper, is my initial thought. Does it have to be this medicine?
The website LeMay primarily uses is called needymeds.org. Not only can you find coupons and rebates, but also sign up for a drug discount card. Here, you click on patient savings and get help with prescription assistance applications. LeMay also says the key is to communicate with your doctor.
Calling and just networking is the biggest thing, and just letting, making people aware of what's out there, and that there are other options than not taking their meds.
Still, Dr. Shah argues more must be done.
Access to health care and affordability for medications should be a fundamental right of every person, every citizen in this country. The solution has to start from the very top.
So we went to 2nd District Representative French Hill. He and other congressional leaders want answers from pharmaceutical companies on high drug costs and unreasonable price hikes.
I think we need to understand why this price jump has happened and correct the policy environment in which has caused it. They can't sugarcoat the answer by just doing discount coupons.
He points to a bill that he voted for in the House called 21st Century Cures.
What it does is it speeds FDA's drug approval, particularly where they have monopoly type pricing, where there isn't competition. It also prioritizes how the basic research money for the federal government goes to the NIH, the National Institutes for Health. And it prioritizes diseases that hurt our families the most and cost our families the most pain.
Patients like Dina Fowler, though, need help now.
It just depends on when he runs out or when I run out in the pay period. It's it just depends on the time of the month.
You want to help your patients. You know how you can help your patients, but how do you get it actually to them and see it work?
The 21st Century CARES Act is nonpartisan, and it hasn't yet been passed by the U.S. Senate. You can find more information on our website, THV11.com.
Well, we've talked about the problem, introduced you to the people it affects, and explored possible solutions, but the conversation doesn't end here.
Oh, we've received hundreds of comments over the last few days. People sharing their stories. My son's life-saving daily leukemia medications cost $33,000 for a 30-day supply. Gleevec has given my son 11 years of being alive. Sure, we've lost everything we worked so hard for, but the best gift is our son being alive. How does the pharmaceutical company's top-paid people sleep at night?
Opinions over why prices are so high. It's because pharmaceutical companies control everything. They even got cures, but they would lose money, so they would rather treat you instead of cure you, end of quote.
Even people who witnessed the fight firsthand. So true, very sad. Saw it all the time when I worked in the hospital.
And we want to continue hearing from you. Share your stories and your concerns, and we'll continue investigating this pharmaceutical fight, which isn't over.